Good morning, everyone, and welcome to the Falls Prevention Panel discussion. I'm Rachel Mills, and I will be the host for this meeting. Have you fallen, or has someone close to you had a fall? The National Council on Aging reports that 1 out of 4 adults 65 and older fall each year. Arizona is home to 1.5 million adults ages 60 and older. Many come to enjoy the warmer weather and to retire. Arizona's 60 and older population is projected to grow more rapidly than any other age cohort in the state. Falls in northern Arizona have some of the highest rates in the state. So today's discussion is a very relevant topic. The panelists and moderator for this session are passionate about the topic and have been working in various capacities to raise awareness, provide risk reduction, and will share their expertise with us today. If you have questions throughout the webinar, please type those questions in the Q&A box at the bottom of your screen. There will be time for questions at the end of the panelist presentation. We'll get to as many questions as we can. Moderating today's panel discussion is Dr. Babek M. Nayeri. Dr. Nayeri is the director of the Healthy Aging Program at the Arizona Department of Health Services. He serves as the immediate past chair on the Arizona Falls Prevention Coalition. He is a board member with the Attorney General's Task Force Against Senior Abuse and a team lead with the Healthy Brain Initiative Learning Lab. Dr. Nayeri is a clinical associate professor at the University of Arizona College of Medicine, Geriatrics, General Internal Medicine, and Palliative Medicine. Dr. Nayeri, thank you for joining us today.
Thank you, Ms. Mills. Good morning, everyone, and welcome. I would like to share a few fun facts, although I'm going to dispense with some of the facts that are not so fun. So falls are the most common thing among older adults that lead to injury and mortality. So of course, have you thought which gender has the most number of falls? Well, females 85 years and older have had the highest number of fall-related mortality. And while everything has changed in our daily lives because of the pandemic, one thing has stayed constant, and that's fall-related injuries. So as I shared with you earlier, the leading cause of injury-related deaths among Arizona residents 65 years and older are due to falls. And 41% of fatal falls have suffered traumatic brain injuries. We do know that based on recent studies, fall-related injuries that cause or result in traumatic brain injury can lead to depression and higher suicide risk. And we have had over 1,100 fall-related mortalities in Arizona as of 2019 data, or based on the 2019 data. Now, just to stir up some competition among our counties, and since we are talking about falls in the northern parts of our beautiful state, Yavapai County has the 4th leading cause of or a number of hospitalizations due to falls, followed by Coconino County being the 10th leading county as far as unintentional fall-related hospitalizations in Arizona. And Navajo falls in between. So Navajo County is ranks 6th in the state and among counties, all 15 counties. So there are counties that have higher number of falls, and just so that we can get our perspectives in order, the reason that there are more falls in northern Arizona, part of it has to do with inclement weather conditions. You have, seasons where you have more precipitation or rain. You have winter with snow and ice, so slippery surfaces can lead to more falls. And of course, we have more people choosing northern parts of Arizona and the counties of Yavapai, Coconino, and Navajo counties as a place to retire. More people are moving there. So we will obviously have more falls. But the northern part of Arizona is doing really well in terms of managing the falls, educating people, and reducing the number of falls based on our 2019 data. So the Arizona Falls Prevention Coalition is a statewide coalition made up of 3 chapters. Northern chapter that is presenting to you today with distinguished panelists, and we have the Western chapter, of course, the Southern chapter in Arizona. And each of the chapters are comprised of counties, different county partners, as well as public and private sector partners, including our fire and medical departments and regional medical centers. Our panelists for this event are Ms. DARCEY MCKEE. DARCEY has worked in public health for the past 30 years, with most of her focus on tobacco and chronic disease prevention. She has helped build the awareness and bring resources regarding falls prevention to Navajo County. She and her team have been working on ways to continue these valuable resources during the current climate. We also have Mr. Corey Cooper. He's an injury prevention health educator with the Coconino County Community Health Services. He's a certified Tai Chi instructor for health, Tai Chi for health instructor, and a matter of balance coach. Ms. Beth Brio has been a leader in the field of nutrition and wellness with the Northern Arizona Council of Governments, NACOG, Area Agency on Aging. In her various capacities, she's a master trainer for a matter of balance. She's also the co-chair of the Northern chapter of the Arizona Falls Prevention Coalition. And last but not the least is Mr. Dave HASKELL. Dave is an engineer paramedic with the Prescott Fire Department. He is currently serving as the department's emergency medical services coordinator. So to start off, let's ask DARCEY a question. Are falls a natural part of aging, DARCEY?
Falls are not a natural part of aging, although I do believe elderly people fear falls so much that they begin to think that it is just a natural part of the aging process. One of the great things about today's discussion that you're going to learn is that there are a ton of resources out there. There's skills that you can be taught to help build your confidence so that you can live a very active, full life with confidence of not having that fear of falling all the time.
So let's take a poll question, and we're going to be displaying and sharing the results with you live. So if you would please take a moment and respond to this question with 2 simple answers, yes and no. Are falls humiliating? So here are the results. So 86% of you responded yes. And having fallen myself, it seems like every year I we tend, those of us in the business, with all the education of other people and being aware of what the risk factors are, I have fallen once every year, it seems like, for the past few years. So 80%, 86% of you said that they are humiliating. Now, after looking at these results, would you say, what would you say that why people hide when they fall, or what is humiliating about falling? Why have they fallen? Is it as a result of losing your balance? So let's turn to our next panelist. Beth, would you please share what the greatest risk factors are for falls among older adults in your communities?
I think you talked about northern Arizona being more risky as a result of winter, but also we live at elevation. It's very dry, and people tend to not drink enough water, especially in your older years, because you lose that sensitivity to thirst. So many people are dehydrated for when they find themselves in emergency as a result of a fall, not realizing that that could be the whole problem. And as far as falls being humiliating, I think that's part of the human condition. I always like to tell people to remember when they were a kid and they fell off their bicycle, what was the first thing you did? You looked around to see if somebody saw you. So I think the same thing happens today. But if you don't share the problem, you can't find solutions. So if you keep that to yourself, it may get worse. There are many, many things that can contribute to a fall that can be corrected, but if you don't get that information out there. And I just want to say, pride can get in the way. We're a self-sufficient, can-do society, and we like to do things for ourselves, but what do they say about pride? It goeth before a fall, and I think that's no mistake.
Thank you, Beth. And, I fell off of a ladder. No one was around to watch, and I still felt embarrassed. So go figure. Now let's ask Corey and then Dave, respectively. How about you guys? What are the greatest risk factors in your communities, as what you observe?
So here in Coconino County and Flagstaff, there's tons of risk factors, but for one, I think one of the largest ones we have is just seniors as they age. Sometimes they are not as active and they lose that strength and stability more than they realize. And so a lot of times this leads to a fall. So that's what I would list as one of our biggest risk factors, is just losing either due to inactivity or an injury. They've lost strength in their, specifically in their legs, lost strength and flexibility.
Thank you. And would you and Dave also weigh in, perhaps any of the panelists, one at a time, of course, not all at one time. Where do most falls take place?
I can take that one, Doc. A lot of the falls that we see more often than not happen in the individual's homes, and we see people tripping over things such as oxygen hoses, rugs, just anything that could kind of just get in their way and trip their feet up. But for us, I would say more often than not, the falls are happening in the homes. Thank
you, Dave. And I sort of let the cat out of the box and gave the answer to the next question away prematurely, but we would like to invite your input as well. Perhaps you have a different perspective. If you would participate in the next live poll with us. Here's the question: where do most falls take place based on your experience? And you have three options. So read: parking lots, at home, on walks. Great. So I think 88% of our audience agrees with us that most falls take place at home. Thank you. So We appreciate your participation. So we asked our community member, Kathy, to share her fall experience, and the panelists and I will be listening as Kathy shares her experience with us. Welcome, Kathy.
Thank you. Good morning, everyone. I'd like to talk about my fall story that happened 2 years ago, actually. I was getting ready to go on a wonderful dream vacation to Aruba with my fiance. And it was the Saturday before we were leaving. And of course, you know how much time it takes to prepare and get everything that you need. Well, I decided I wanted to go on a 5-mile hike. I then wanted to stop by Walmart and get my cat food and cat litter and all the toiletries you need for a great vacation. And then I wanted to shower. I wanted to pack an overnight bag and then go to Cottonwood, where I would meet my fiance where he lives, to go over any last minute plans. And I wanted to do all of that before 11 a.m. Yeah, I know I have pretty high goals, but that was my plan. Well, I went on this great hike, took a little bit longer than I expected, rushed into Walmart. Lines were long, took a little bit more than I expected also. And I came home and I'm unloading everything from my cars. And I was carrying, and I was literally jogging from my back door through my garage to my truck outside and carrying things in and jogging. So I was carrying a 20-pound bag of cat food, and I had it in my arms, and I tripped. I tripped over this bag of potting soil that I've been saying to myself for about 4 months, I should push it back a little bit. It's a trip hazard. Well, when I fell, the first thing I thought, like 86% of you did, I was embarrassed and I wanted to make sure no one saw me. And there were two 12-year-old boys that were in my cul-de-sac. And I saw them and I'm like, oh, they didn't see me. But then when I tried to push myself up with my hands, I couldn't do it. When I tried to get on my knees, I couldn't do it. I realized I had my right leg wasn't injured, but everything else was. And I shimmied myself up and I got into my house and I sat there. And I thought, okay, it's just gonna go away. You know, it's just a sprain. I just jolted myself. Well, no, it didn't go away. I called off going over to my fiance's house and I thought, okay, the next morning I'll be fine. And then the next morning, well, what happened when my director finally told me to go see a doctor, I had a navicular fracture in my right hand that if I let go any further, it could have led to nerve damage. I had a severe sprain in my left hand, and I severely sprained and got tendonitis in my left leg. So 8 months with the cast on my right hand, 4 months of physical therapy on my wrist, hands, and leg, and then a year of getting my upper body back into shape after all the atrophy that occurred. So I just want to say that I did go to Aruba. I had a great time. I got priority boarding and I was wheeled around in a wheelchair since I couldn't go distances. And my fiance learned how to do a mean ponytail. So he's a keeper. But that is my fall story.
Thank you for sharing your story with us, Kathy. Now, let's ask our panelists to weigh in on your story. I wonder what some of you heard Kathy share. Dave, would you like to tell us what you heard?
You bet. Yeah, Kathy, I'm glad you're okay and glad you were able to make your vacation. That would have been a real bummer had you not been able to. Yeah, a few risk factors that you touched on. One, you said you went for a hike earlier in the day. You could have just kind of pre-exhausted yourself and just been a little bit too tired to be in a hurry and be carrying a 20-pound bag of dog food. So I think that's important to talk about, and carrying too much. And then I like how you mentioned trip hazards. That's one of the things that we try to educate a lot of our patients that we run on, and we see potential trip hazards in their homes. And you talked about your bag of potting soil was in your way, and you had meant to move it quite some time ago and just never got around to it. So our recommendation is kind of just do a quick glance over your home and see if there's anything that you could potentially get hung up on, you know, even if it is a year later, however long it may be. So but yeah, I think you're probably just in a little bit of a hurry and carrying too much, and that definitely, that didn't help.
Thank you, David. How about Beth? Would you share with us what you identified as risk hazards or risk and hazards with Kathy's story?
Sure. I just want to call attention to just how many risk factors occurred to contribute to one fall. I know that sounds like Kathy was distracted by her perfect vacation in Aruba and wasn't really there in the garage. She had no hands free to break that fall, and that is a reflex action that's important to be able to use at least one hand. Better your hands than your head, although it was you know, a pretty tough recovery for her. Overscheduling and hurrying and just thinking about those things all the time totally takes you out of what's really going on. And I know it seems simple, but it's really important to pay attention, like Dave said, what's around you. And you know, we do fall in our homes mostly because we're there most of the time. And that's the place to keep safest of all.
Great points indeed. And we have a very observant and with great listening skills among our panelists. That's why we selected all our panelists, handpicked them. So Darcy, what did you identify in Kathy's story, if you would mind?
So I definitely have to agree with Dave and Beth and their insight and knowledge. One of the things that I really heard when she was talking about it was just trying to meet all of her goals and not enjoying the fact that she was going to go on a vacation and just kind of relax a little bit because she's going to get exercise and stuff on her vacation, I'm sure. But she mentioned that after Kathy said that she had fallen and she was able to get up and get inside, she elected to get medical treatment, or at least maybe find somebody who could give her a little more advice. And she let it go a couple days. And like Kathy said, had she let it go further, could have resulted in serious permanent damage. And I always have find with people who fall, because you're humiliated, like the 86% had said, you're embarrassed, you don't want to admit that you fell for whatever reason. So you do try and shake it off, or we take that attitude of suck it up and keep going. So really, I think it's important that after you've done an evaluation of your body and you've given yourself 15 to 20 minutes, you do seek some type of medical opinion, advice, if not seeing a doctor.
Thank you, Darcy. And I'm not gonna skip over Corey. So be sure, rest assured, I'm gonna call on Corey in a second. But I do have a special question I want to ask Corey first. We often hear people ask, "What is the best way to fall?" What would you say to that, Corey?
That's a really good question, and it can be difficult to answer. You know, trying to prepare to fall is like trying to make the best out of a bad situation. The most important thing I think to remember is, you know, we want to protect the head, neck, and spine primarily. We have to accept that if we are, you know, a senior and we are falling, that there is, you know, a likelihood that there will be some injury. We want to minimize that as much as possible. So you want to try to avoid striking your head as you go down. So in Kathy's story, you can see that she was holding dog food, a bag of dog food in our hand, which you don't want to be carrying anything around that occupies your hands, because if you fall, you want those hands to come out like a shock absorber. So the moment that you realize you're losing your balance, so you feel like you're going to fall, you want to go into a crouch. You want to have a bend to your arms and legs. So as you fall, those bent arms and legs are better able to absorb the shock and also protect the head. I'm going to post a link in the chat function. I'll probably post a couple links with some information for today. But yeah, that's one of the most important things to remember is if you feel yourself going down, you want to protect your head. So you want to get your hands out, not fall directly on your face if you can, like fall to the side and get those hands out as sort of shock absorbers and protect your head. Because bones, we can put a cast on and we can repair that, but it's much more difficult to repair the brain and spinal cord.
Thank you, Corey. See, there you heard it from the Matter of Balance coach and the Tai Chi instructor, Corey. That's great. And of course, that's how you probably protected yourself, Kathy, when you fell. That's why you injured the navicular bone in your wrist, right? So you
Yes.
probably used your hands to protect you and use them as shock absorbers. So if you had not, the consequences could have been more dire. So thank you, all the panelists. There is a question from one of the audience, or actually a story that one of our participants has shared. I wanted to share that with everybody. It says, sometimes those who see or witness our falls may not know how to proceed or help us. Even just a quick, "Are you all right?" from those apparently this individual had fallen at a restaurant and nobody knew how to respond and nobody helped her, or helped him or her get up. So this next question, and I'm going to call on Dave to see what his experience is. Dave, could you tell us, since you have extensive experience in helping individuals after they have fallen, what advice would you give to our audience, to someone who has just fallen?
Yeah, so if you have just taken a fall and you're really concerned that you may have severely injured yourself, we want you to try to stay nice and still, especially if you were to hit your head, because we're really concerned about head injuries, and like Corey mentioned, the neck and the spinal cord. That's our biggest concern. So if you truly feel that you've significantly injured yourself, stay still, call for help. Let people know that you need assistance. Like I said, that's one of my biggest recommendations is just stay put if you're convinced that you're pretty injured.
Great advice. Thank you, Dave. And I wonder, for someone who may be a first responder to an individual who has fallen, a caregiver, family member, loved one, or an innocent bystander, what would you recommend to them, Dave? What would be the best way for them to assist the individual, especially in light of the story that was shared by one of our participants, community members who had fallen at a restaurant?
Yeah, it's pretty sad that no one even came over to that individual and asked if they were okay. That would obviously be our first, or my first recommendation is, talk directly to that person and, see if they're able to tell you where they feel like they're injured or if they're experiencing any pain anywhere. And then we try to tell people if we're concerned that person hit their head hard enough or could have possibly damaged their cervical spine, we try to maybe just if they're comfortable with it, put their hands on the individual's head and just try to keep that nice and still until we're able to get there and then do our assessment and package that patient up if we need to take them into the hospital. So, first and foremost, be courteous and at least ask if the individual is okay, and and then don't hesitate to call 911 right away.
Thank you. I'm going to keep picking on you, Dave, if I may have your permission. We're going to make sure that you earn your keep today. So how has the pandemic changed the way that the Prescott Fire Department responds to fall calls, Dave?
It hasn't changed it at all. All you're going to see different is just our level of protective PPE that we're wearing. Before the pandemic, we weren't wearing N95 masks on any of these calls, but all calls from now and probably the foreseeable future, you're just going to see just a higher level of PPE from our responders. Everyone will be in a face mask, and we even have spare face masks that we've been given to patients that we've been running on just to kind of protect them from us and vice versa, but not changing the way that we respond. You call 911 and we're still showing up just as we did before the pandemic.
Thank you very much, Dave, for indulging me with and allowing me to ask you all these questions for the benefit of our community members. Now that we've talked a lot about risks and falling, and I'm not talking about falling in love, and I'm not talking about the fall season, now that the new season of fall has begun, but slip and falls. Let's take a look at the prevention aspects. What can individuals do to reduce their risk of falling? Corey, well, maybe, how about if I call on Darcy and Dave after Darcy? What is being done at the community level to educate the public?
So one of the things that we do in our community is we try and get information to doctors. If it's just a small little prescription pad sized education flyer for them to give patients. Because one of the things that I think gets missed a lot of times in the medical field is doctors prescribe new medications to patients, or things like a patient may have a vitamin D deficiency, and that could cause a fall in itself. It could change your equilibrium, it can make you dizzy. So when a doctor prescribes a different medication, there's just a quick medical pad that they can tear off, give to that patient for reading, that just gives them some awareness that you may experience some of these symptoms that could possibly cause a fall. We also provide information out there to our community of where they can go for resources. So lots of those things can be online, it could be in person, but we try and put them in locations where some of our elderly are going to be. So senior centers, the laundry mats are a great place to put flyers or education materials and resources. Pharmacies, the public library, Meals on Wheels is a great location, and our city works very well with us to do stuffers and water bills. So we can also add education through that. Just making sure that people are aware of those risk factors that could be either physical, like medication, or reminders. Have you had your annual vision check? Just those quick little reminders that could prevent a fall by doing just a simple little step, or, you know, like we mentioned earlier with Kathy's story, looking around your house and making sure everything are moved. So it's just having that little kind of nagging, if you would say, reminder.
Corey, how about you? And perhaps if you could both chime in on and weigh in on how has the COVID-19, the pandemic, changed anything, dear, as far as education and falls prevention?
So, you know, it's definitely been a huge change with the pandemic and how we are able to do education. Obviously, a lot of that education that was being done before just isn't being done now. We're in the process of trying to get back to normal. But it's also pressed us to kind of grow in this digital age and take advantage of technology. You know, just like this conference that we're doing right now, in that we can, you know, reach people, and we're all over the map geographically, but we can come together online to educate and network. So that's the same thing that we're working on now with COVID is just trying to reach out and provide, you know, outreach opportunities, you know, via phone, internet, that we can provide, you know, a similar product and education that we were doing prior to COVID. And yeah, what else did you ask, Dr. Nair?
That's pretty good. You covered it very well. I wonder, in Navajo County, Darcy, have you experienced any change, or are you responding to things differently? Anything you would like to add to what Corey shared in terms of COVID-19 and our efforts with falls prevention?
So definitely chiming in with what Corey said, we're learning to grow. I think this has really been an experience for all of us to force us out of our comfort zone and making us think outside the box. We are working locally in our health department on creating some videos, doing some different things, but our county is very unique because not everybody has access to internet. So we've also started working with some of our partners who have bigger auditoriums that we can utilize to bring people in on a safe level. Again, making sure we provide masks, checking temperatures, those kind of things, and then offering more classes with less people so that we can get these services out there. We are limited still on how much traveling we can do, and we do borderline the reservation being Navajo County. So those areas we're still working on trying to partner with maybe local hospitals or clinics that we could do some kind of a live feed in and provide the education. But we're really working outside the box, and we love any feedback or information from our participants, because sometimes what we think locally works great doesn't work so well for those people who are actually trying to receive the class. So we're open to any ideas and just learning and growing.
Wonderful, thank you. Now, as we encourage you to stay active while sitting in one place, as I've been sitting during this conference, and you keep observing me move around as I slip off on the chair. I keep having to move back up because I'm slipping even on my chair. So be careful, because you could slip off the chair. And while we can't be active as we're attending and participating in this conference, let your fingers do the walking, if you will. And we're going to have another poll question for you. What community fall prevention programs have you participated in? Possible options or answers are a matter of balance, Tai Chi, fall proof, or other. Okay, so 70% of you have participated in something other than fall proof, matter of balance, or Tai Chi. So about 30% of you have participated in Tai Chi. That's wonderful. And since we have so many Tai Chi instructors in northern Arizona with different counties, I hope that you take advantage of that. And also matter of balance. You heard Corey's matter of balance coach, so is Beth. And I know there are others in Yavapai County. So please take advantage of those opportunities. Thank you. Darcy, based on the poll results, and following up on that, if someone is interested in participating in a community program, who can they reach out to?
So one of the easiest ways would be just contact your local health department. In Navajo County, all of our health departments know of our services. And so any of your local health departments would be able to get you that information. Also, you could reach out to your primary care physician, because most of the time they would know to refer you to the public health offices. Or you can also look, like I said earlier, for the flyers. There's materials out there. A lot of times people have that. I think in other communities, really your public health department is kind of that one-stop shop, but you also could reach out to gyms or senior centers, and they would be able to get you that information if it's not readily available. And of course, we all know that in this day and age, Google. You can Google it and find websites of your public health offices, or I know I'm a Matter of Balance coach here in Navajo County, so you can Google on Matter of Balance, and a lot of times you'll get maps of where people are coaches, and then you can click there and get your information from that. So
Fabulous. Thank you. This has been an enlightening discussion, and I'm sure you all agree with me, our participants. We'll take a 5-minute break soon and also offer a simple chair exercise. So I'm going to make sure that I don't slip off my chair as I do that exercise. But before we do the panelists have any comments? The floor is tender to any of you.
I just want to add that also a good resource is Area Agency on Aging, because we serve all 4 of the northernmost counties. So NACOG or Area Agency on Aging. And as Darcy said, you can Google that as well.
Corey, you had your hand up. You wanted to chime
Yes,
in?
if there was one thing I would, just communicate to those concerned about growing older and risk of fall is just remember, if you don't use it, you lose it. And this is true with regard to muscle strength, bone density, mental acuity. You don't want to just sit around thinking that if you don't do anything, you won't be at risk. But the reality is at some point, everybody's got to get up, go out the door occasionally, take a bath or shower occasionally. So you do need to continue to put a little bit of stress and strain on the body, a little bit of activity. And we're going to show you that with a few exercises. But there's a lot of good information out there, and you need to stay at some basic level of activity.
Great, thank you. Any other distinguished panel members? Go ahead, Dave.
Yeah, I just want people to know, don't hesitate to call the fire department. Even if you're not injured, we pick up people on a daily basis, because we don't want loved ones or family members, we don't want them getting injured trying to pick up, the individual who has fallen. So don't ever hesitate to call us. We're happy to do that. And I would imagine that goes for any fire department within Northern Arizona, within Arizona.
And of course, always exercise courtesy to ask somebody who has fallen if they're okay and if they need anything. So then call your fire department. They're wonderful. Thank you for your service. Beth, do you have something else you want to share?
I just want to say, I think sometimes people are under the impression if they call the fire department 911, they're going to get a bill. But that's not the case. Your taxes pay for that service. So know that it's available to you, and the fire department are the experts on falls.
Good to know. Thank you. Any last closing comments before we start our break?
Dr. Nayeri, I'd like
Yes,
to just kind of add in there. A lot of times we've talked about humiliation of falling, but they're embarrassed or humiliated to use proper tools, if you would. So a walker or a cane. And I think that that's one thing that we need to just have our confidence that it would be more humiliating to fall than it would be to be using a walker or a cane. And if you do use walkers or a cane or some other kind of assistance, make sure that you're properly fitted for that so that you're not causing yourself to have a larger risk by improperly using an assistance.
Wonderful. Thank you so much for that important message. So there will now be a 5-minute break. You're welcome to take a short break, or you can stay with us, and Beth Ms. Brio and Corey will lead 2 exercises that we can do, we can join and participate in to build our strengths and improve our balance. So also, if you wish to take this time to submit a question for any of the panelists, please type your question, and panelists will address them in a Q&A feature at the bottom center of your screen. So I will turn this over now to Ms. Brio now to walk us through a few chair exercises, and I'll be turning off my video to turn it over to Beth. Thank you, Beth.
Morning, everybody. Just going to take a few minutes to learn how to breathe correctly. Many of us don't breathe deeply enough. We have a muscle here called our diaphragm, and the rest of our body needs some activity and exercise. So does this breathing muscle too. So go ahead and place your hands where your ribs begin to separate and just do a few deep breaths. Make those breaths last a little bit longer. And what this does is it helps energize our bodies, our minds, and increases circulation. So we experience better communication throughout our whole body, from our brain to the bottom of our feet. And take it away, Corey.
Oh, let's see. All right, so the first one I'm going to do here is the good morning stretch. So as Beth mentioned, breathing is really important, and that's an important part of this good morning stretch as well. So we're basically just going to bring the arms out wide. Nice deep breath. And then we're going to turn side to side. These exercises, some of them anyway, like the breathing and the stretching warm-ups, really good time when you wake up in the morning, instead of just hopping up out of bed and risking that lightheaded feeling from the blood pressure dropping. If you have a bed that you can sit on the side of the bed and kind of touch the floor, that's a good place to stop, take a couple deep breaths, get that stretch, really engage the back, shoulders, neck, and warm up for the day. Thank you.
Okay, now we're going to move down to our lower body. So if you could see my ankles. So in every joint, there are cells that can sense where we are in relation to other things around us, whether there's a bookcase or a wall there or a cord, gravel, cracks in the sidewalk. And if we don't keep those cells active and sensitive, they don't communicate well to our brain to keep us upright and stable. So one of the ways we can do this is to just circle your ankle joint. If you can't lift your leg, just rest your heel on the floor and go in the opposite direction while you continue to breathe. Yeah, so this is the magic of these exercises, is they can be done while you're watching TV or with other activities to take a break from. If you're reading, take a few minutes to take a break. Yeah, and just make them work in your life, in your schedule. That's how best to keep doing it. Corey?
Thank you. So hopefully I can get my camera oriented so you guys can see. So this one's going to be seated marching or seated knee raises, which are really good for strengthening that lower body and also stability of the hips. So you want to stabilize yourself in a chair and just raise the left leg up and down, and then the right. And initially I've had some students who couldn't even barely get their foot off the ground when they first started this. And that's fine. Studies have shown just visualizing moving a limb, you can get some of the same benefit as actually moving that limb. Also, I'm using my hands for stability, but if you do this with your hands free, you're also working that core strength at the same time, because you have to stabilize your entire body. So really good exercise, the seated knee raises there.
Yeah, great. Thank you, Corey. So these small exercises are something you can begin to start using in your daily life now. Thank you.
All right, thank you, Beth and Corey. So now we're going to share a video about the Northern Chapter. And this was created by one of our partners with the Northern Chapter, Yavapai Regional Medical Center. they were able to put this all together, and so we'll just go ahead and share this with you. Just as a reminder, if you have any questions for the panelists, please type those questions into the Q&A feature at the bottom of your screen.
I'm really glad to be able to get to all these projects around the house. I'm really enjoying retirement. And I don't want a fall to take that away.
I love having the time to do the things I've always wanted to do. And here in northern Arizona, there's so much to do. I really don't want a fall to take that away.
There's nothing like the open air on my bike. I can finally take off whenever I want to, and I wouldn't want a fall to take that away.
Your retirement years should be full of the things you've always wanted to do, especially in the beautiful climate of northern Arizona. The last thing you need is an accidental fall. For instance, stairs and wood floors are prevalent in many northern Arizona homes. You might be new to the area, and maybe you're not used to them. The hilly terrain of northern Arizona, freezing winter weather, wind, icy streets and sidewalks, or even the new activities that you're enjoying could all increase your risk for a fall. In an instant, your retirement plans could be put on hold, or worse.
Well, people always fall. Injuries, for the most part, tend to be slight, but as a person gets older, they become more serious. With fall fatalities, a person of working age will only have about 1 or 2 per 100,000 people having a fatal accident, whereas as we get into people 85 years and older, it jumps up to 200 per 100,000. Since Yavapai County's population tends to be older than other parts of the country, epidemiologists adjust these statistics by age so that we can compare apples to apples. When we do this with fall fatalities, Yavapai County's rate is higher than Arizona's, and Arizona's rate is higher than the United States. So we're very concerned as to why we have higher rates than everywhere else.
Falls are a significant impact to that patient population. Specifically, if they have other related illnesses, be it heart problems or mobility problems or respiratory problems, and then you add a fall injury with a fracture, a hip fracture on top of that, then that can really up the risk for higher mortality rates, as well as longer time to convalesce, to get back to their normal daily living activities.
At 59 years and below, the admission rate for falls is about 17%. And then 60 years and above, admission rate is up towards 50%. These statistics are alarming. They are nationally recognized, and most trauma centers are making that push for an increased awareness for geriatric trauma. American College of Surgeons made note of this probably about 5 years ago, and it's just now filtering out into the rural communities and the local trauma centers and their community outreach programs.
Local community outreach is the key. In northern Arizona, a team of experts is working to get the word out. It's a local chapter of a statewide and national movement. They're known as Arizona Falls Prevention Coalition Northern Chapter.
The goals of the coalition are to use our combined resources as a group of organizations to prevent falls in northern Arizona through education, raising awareness, developing videos and other educational resources that can benefit our communities.
It's reassuring to know that you've got a powerful coalition out there working hard to educate you about the risks of falls and how to prevent them. In the meantime, there are things you can do now to keep safe from falls.
The main tips, the take-home message that I would give people to help prevent falls is, number one, start with medications. Take your medications to your doctor, go through them and say, do I really need these and what are the risks? And do that also with your over-the-counter medications and all those herbs, et cetera, that you take from the naturopath as well. Those are medications as well, number one. Number two, I would go through the house and say, what are my hazards here as far as loose rugs, furniture that's not really stable. Number three, well hydrated. Keep drinking those fluids. Keep drinking the fluids. Number four, when you wake up at night, slowly get up. Or even in the morning, slowly get up. Sit at the bedside, pump your hands, pump your legs, okay, and get up slowly. And I guess the last is exercise, exercise, exercise. Even if it's just walking, get exercise. That is key.
Being prepared is the best defense against an unexpected fall, especially as you get older. The goal of Arizona Falls Prevention Coalition Northern Chapter is to keep you informed on how to stay safe from falls so that you can enjoy your retirement filled with physical activity and fun here in Northern Arizona.
Well, we'll go ahead and move into our question and answer session. And we have Carla Hover, who is a health educator with Yavapai County Community Services, who will be directing those questions to our panelists.
Okay. So actually, I don't have any question and answers in the box, and that video summed up everything very nicely. I did have another question. Corey already mentioned getting up in the morning. If I feel dizzy when I get up in the morning, Corey gave us some good hints. Are there other hints of how we can safely make sure that we're getting up and out of bed and moving first thing in the morning? Some of us are kind of stiff and it's slow going. Beth, do you have other ideas on that?
Sure. Yeah, definitely everything that Corey said, and what that says to me is taking your time and not hurrying. If you're anything like me, I'm already thinking before I'm in operation, and sometimes I get up too fast. So taking your time, taking a few breaths, exercising that breathing muscle, and you can pump your ankles just simply, back and forth, or make some circles to get the circulation going. Oftentimes, as we age, our circulation doesn't move as fast as it once did. So we just use that pumping action to help that along. And that can help you from getting dizzy and feeling unsteady.
Yes, thank you. One of the things I have to remember in the morning is I just take my time. I used to be able to just jump out of bed and get going, and I just have to take my time, do my foot pumps, stretch a little bit, and then I'm ready to go. So that's very helpful. I have another question here, and we've covered it, but if any of the panelists have other ideas, if you have poor balance when you're walking, what can you do to help you move better? We talked about canes and walkers. What else? What other things can people do?
I'd like to point out that just smart footwear can be a big difference for a lot of people. Just examine what kind of footwear you're using. Are they comfortable? Are they stable? Is it the safest option? A lot of us just choose something based on looks or popularity, but really pay attention to what you're wearing on your feet. And that's in the home as well as out of the home for slip hazards or trip hazards.
Thank you, Corey. That is very important. When I'm doing Tai Chi classes or matter of balance classes, the very first class, I look at people's footwear and go back and suggest that they wear something a little sturdier. Good chance to get some bright sneakers. They have so many choices out there.
I could add something. Uh-oh, where'd it go? Oh, I was going to talk about eye focus. A lot of people, when they begin to feel unsteady or have had some falls, tend to just look at the ground. So practicing scanning up and down, there are things ahead of you. I like to compare it to driving a car. When you're driving a car and moving forward, if you stare at the hood, it doesn't work very well. But looking ahead and seeing everything that's around you, and that can be scary. So as I said, you can practice this at home while holding onto a chair or a steady counter. Practice that moving your gaze around and holding your eyes up.
Thank you, Beth. That's very helpful. I had not thought of that one before. Okay, another question. What can a person do if you're one of those people who have always fallen your entire life? I am known for falling over things that aren't there. Would anybody like to chime in on that one?
I'll go ahead and jump in on that. So one, I think, and I'm speaking from experience because I tend to trip over the air as well, using the exercises that are provided, Tai Chi has been a godsend for me, that really strengthens those core muscles. It has helped a ton. Going back to what Corey said with proper shoes, making sure that you're aware of your surroundings. One other thing that I have noticed sometimes because I live in Winslow, if I go to Flagstaff, the change in altitude. And so just being aware of my surroundings before I jump out of the car and take off, taking a couple deep breaths, just really utilizing all of the tips and skills that we've talked about in this conference today.
I would like to address that as well. You know, we've all, you know, had a misstep or tumble at some point, but if someone is repeatedly falling, tripping, having accidents, you shouldn't just accept that you're clumsy. That should be a flag, you know, a warning sign that hey, maybe I need to go get checked out, and that could be your vision. Maybe you have to upgrade prescription. It could be some medication you're on that's affecting your balance. It could be, you know, a hidden, you know, symptoms of some sort of hidden issue that you have. You know, I've got a couple students that have MS, and when some of these things first arise, they don't immediately know what's going on, and they may just think they're clumsy. So if someone is repeatedly having a fall, don't accept that as being normal, and really try to find the root cause of that, and go, you know, speak with your doctor and your ophthalmologist and your pharmacist, and really try to find out why you're so unstable so often.
Okay, thank you, Corey. That's great. Another question. Oh, this is interesting. So I have a small dog that likes to follow right at my feet. What can I do to not stumble over him? I have one that sits under my feet, so I would like that question answered. Somebody want to jump in?
I'll go ahead and speak on that. I was kind of holding off for Corey because I know he has dogs, and so he might be able to give some better advice than I would. But I think training your animal to kind of stay away from your feet, and some different ways of doing, if you have like a dog obedience school that you could go to, or just some free things at home, keeping them on a leash where you can kind of guide them to your side or in front of you, behind you, so that they're not right under your feet, keeping a short leash. And animals are smart. They're going to learn after a few times when you move them to the side, you know, offer them treats. I don't know what all the dog training things are, but I definitely think that just working with your pet to really just kind of redirect them, they'll learn that habit and that pattern.
Great.
That's great, Darcy. Are you sure you're not a dog whisperer?
No. I'm more like a dog runner because I'm afraid of them.
I want to add, in addition to the pets being around, along with pets comes a lot of other clutter, dishes on the floor, toys, anything that they drag out. So being aware of their habits, because they don't always listen that well, at least not consistently. So, you know, it's really our job to really become aware of their habits more than anything else.
Absolutely.
And there are adhesives that you can purchase to secure their dish or their bowl, their drinking food bowls and their mats, so they don't slip and get in your way. As Beth said, the dogs, pets can't pick up after themselves, so we got to pick after them and make sure that things are not cluttered. Thank you.
Yes. Okay, so another question. When getting out of the car, I have to move my right leg with my hands, and I get worried about falling out of the car. Are there any assistive means that I can use?
Yeah, there is a couple of great devices that I've learned about through occupational therapists. One of them, it's almost like a dog leash. It has a loop at the end and it helps lift your legs without struggling so much. There's also a rotational seat that you can put in your car seat. You get in this way, and the rotational seat brings you in front of the steering wheel. And these are all pretty economical. You can get them through Amazon. Yeah, a lot of assistive devices are available. And I did put my contact information if anybody would like to reach me and talk about that.
Great. Yes, and I do want to remind all the panelists to please put your contact information into chat while we're talking. So if people have further questions for a certain county, a certain area, they can feel free to reach out to you. Okay. I guess I'm going to open it up for any of the panelists that would have last minute, anything we didn't cover, anything you would like to add to our discussion. This has been a great discussion.
I feel like I talk too much, but I want to say one last thing. With regard to what Beth said, is great that there's so many tools and devices out there to help us with our life and mitigate, dangers or hazards that we might feel. We all at some point thought age was this thing that you get to a certain number and this is how things have to be. And, as we age, I've come to understand it really is just a number. Don't give up the life you deserve just because you are worried about your age. I think everyone has the ability to stay active and live that full life, regardless of, being 70, 75, 80, 85. There's so many tools out there. I just encourage people to really look into the tools available to continue living your best life and not be too proud to use those tools. So that's all I wanted to say.
That's a really good one. I'll say my stepfather has all the tools available to him, and they're all in his house on the back porch, and he's too proud to use them. So that is a very good point. Thank you, Corey. Okay, other panelists?
I'll add to that. It was a perfect segue to what I was thinking. We know a lot of things, and I'm sure all of you out there that are participating with us know a lot about fall prevention. But if we only know it and don't use it, like Carla's, did you say stepfather?
Stepfather.
Yeah, if we have these things, they don't help us unless we use it. And we are the only ones that can take that responsibility. So like Corey said, keep the gold in your golden years and let these things help you go forward and keep being active and doing and as he said, living your best life.
Great. Thank you, Beth.
So I think one of the things that I preach to everybody, both young and old, especially during this new normal that we're learning because of COVID, is to live smart, not scared. So really make sure you're getting all of your education, using your assistance tools, living a smart life so that you can live your best life and not living scared, because sometimes fear keeps us sheltered, and then like we've talked about, if you don't use it, you lose it kind of thing. So live smart, not scared.
Thank you. Dave, do you have any last minute comments?
Yeah, and I wanted to touch on this earlier, so thank you for coming back to me. Don't hesitate to buy those medical pendants. We see a lot of success with, people having the pendants around their necks, around their wrists, and individuals who fall and are unable to make it to a telephone, just having access to that button that they can push, that can really do them a lot of good. So don't hesitate to get one of those as well.
Okay, great. Dr. Nayeri, it looks like I may have stepped in and taken part of yours. Would you like to take over from here?
Thank you. So that was going so well. So it was natural. Thank you so much. So thanks for attending the Falls Prevention Panel discussion webinar, this virtual conference. We would have loved to have been with you in person, but given the circumstances of nothing being ordinary these days, thank you for joining us online virtually. And a special thanks to each of our panelists for their time. It's been a privilege, and it is truly a privilege and honor for me to be with you and be collaborating with all of you as our partners across the state. You're just a fabulous, phenomenal number of people with not so much expertise. So when you think about your core muscles, building your core muscles for balance, think about Corey. So when you think about core muscles, think of Corey, and of course the rest of our panels and panel members. I would also like to point out that when you are taking a falls assessment risk, and what I'm asking you to do is take the falls assessment risk that's listed, or it's a series of questions on our website at azstopfalls.org. Again, azstopfalls.org. On the top banner, on the page, you'll see take the falls risk, falls check. Take that check, and also remind your providers that they can, as part of your annual Medicare visits, they can do a falls risk assessment and get reimbursed for it. So please remind them of that. Your team, your provider team, your healthcare team should include occupational therapists, physical therapists, social workers, public health professionals and educators, geriatricians who are physicians trained to work with the special needs of older adults. They're physicians, again, who work with older adults, geriatricians. There are not that many of them, but if you can find one in your community, I would suggest that you work with them. And of course, your community pharmacists, work with them as part of your care team. Remember, in Arizona in 2019, we spent over $3 billion as part of the cost for unintentional falls related injuries. So it's costing all of us in our communities. And of course, if we can prevent a fall, which falls are preventable, it's not part of normal aging, as it's been said, and our distinguished panel has shared with you a number of tips. So please go back and review this tape, the video that was shared by Yavapai County, that was prepared by the regional Yavapai Regional Medical Center. It's an excellent tool. It covers so much information, and it complemented what our distinguished panel members shared. So please feel free to visit back and review that video, as well as the recording of this conference, virtual conference. So this webinar has been recorded, as I said, and will be available and sent out next week, along with the additional resources page and the resources that were shared by the panel members. Thank you again. Stay safe and falls free.